More than 70,000 Americans die every year from drug overdoses. Since 1995, over 1.7 million people have succumbed to drug-related deaths in the US alone. Incarceration is not the solution, treatment is. My proposition is the legal use of drugs ought to be treated as a matter of public health, not of criminal justice. My definitions are illegal, contrary or forbidden by law, especially criminal law. Use, to use a drug, drugs, any illegal substance. Ought, used to indicate something that should be done. Treated, looked at, matter of public health, looked at as a mental health issue that can be treated, and criminal justice, the incarceration of those who obtain drugs. I affirm that the legal use of drugs ought to be treated as a matter of public health, not of criminal justice. As the affirmative, I value quality of life, and I define quality of life as a standard of health, comfort, happiness experienced by an individual and a group. As the affirmative, quality of life is measured by one's ability to live without being negatively affected by moral rulings or societal norms. My first argument is whether a drug is illegal or not is arbitrary. My second argument states that the decriminalization of drugs is beneficial, and my third argument contends that we should be treating drug use as a mental health issue. For my first argument, whether a drug is legal or not is arbitrary and unfair to those who seek drugs as a form of medicine. Many over-the-counter prescriptions such as OxyContin and other pharmaceuticals are far more deadly and addictive than the more natural alternatives that are more beneficial to one's mental health. According to the addictioncenter.org, in 2015, the misuse of OxyContin rose 152% between the years of 2004 and 2014 to more than 105,000 emergency room visits each year in the US alone. Psychedelics are being explored as a viable treatment for a variety of conditions, including PTSD, addiction, marital strife, autism, and depression, according to a 2017 study in the Journal of Psychoactive Drugs. While these drugs are much more beneficial to the mental healing process, they are entirely natural and completely safe to use those prone to addiction. The impact these new findings have are integral to finding safer alternatives to deadly medicines that are normalized in our everyday society. We have been brought up in a culture that vilifies medicines that aren't mainstream but are often safer and more effective than pharmaceuticals. The CDC says that an average of 115 people in the US die daily from opioid overdoses. Yet the private insurers are more likely to pay for Big Pharma's deadly product than for natural, effective alternatives to manage the pain. A randomized double-blind trial from Johns Hopkins in 2016 found that a single dose of psilocybin substantially improved the quality of life and decreased depression and anxiety in people with life-threatening cancer diagnoses. These upholds the value of quality of life because instead of submitting patients to a lifetime of suffering through addiction and experimentation of drugs, these alternatives can treat them in the initial trials. My second argument states that the decriminalization of drugs is beneficial. Countries who have decriminalized drugs have been found to have significantly lower incarceration, abuse, and overdose rates. It is in no one's best interest to incarcerate people with drug-related illnesses, yet private prisons profit over mass incarceration. Research shows that a dependency on drugs lessens when drugs are decriminalized. According to a drugpolicy.org article in 2018, the result in Portugal showed people feel more comfortable to enter a drug treatment. Between 1998 and 2011, the number of people in drug treatment increased by 60%. According to the sentencingproject.org, after the war on drugs began in the 1980s, the total number of people in prison for drug crimes increased by 126%, escalating the amount of incarcerated and called for help from private prisons. The result has been a huge dependence on privately held prisons. Less than 10% of people in the U.S. who are incarcerated for drug-related crimes actually receive treatment, according to a Treating Drug Abuse and Addiction in the Criminal Justice System article in 2018. According to the drugpolicy.org in 2018, there were more than 1.6 million drug arrests in the United States. More than 86% of those arrests are for possession only, and many more for minor selling and distribution violations. The impact that the decriminalization of drugs would be paramount in the building of a better health network for our citizens. Portugal decriminalized drug possession in 2001 and since then have seen a decrease in incarceration, disease, overdose, and several other deteriorating acts. This upholds the value of quality of life because the life is compromised when one is forced to spend their time incarcerated, and no man shall profit off another man's incarceration. My third argument contends that we should be treating drugs as a mental health issue. Society should be treating the excessive use of drugs as a mental health issue and should seek treatment for those who succumb to it, not incarcerate them. When one is accused of selling or consuming drugs, they are often in prison, even for the slightest offense. Prison is no place for rehabilitation and often makes a person more aggressive after the sentencing is over. According to the dualdiagnosis.org in 2017, article states that if only 10% of drug addicted offenders received drug rehabilitation instead of jail time, the criminal justice system would save $4.8 billion compared to the current cost. If 40% were addicted offenders received treatment instead of jail, those savings would increase to $12.9 billion. Not only would this be putting drug offenders into rehabilitation centers be beneficial to the patient, it would also save the prison industrial complex billions in cutbacks. When a person becomes addicted to a drug, there's a certain synapse in their brain that is permanently affected. Their bodies crave this substance and do anything they can to have the same effect. According to the American Psychiatric Association in 2016, addiction is a complex condition, a brain disease that is manifested by compulsive substance abuse despite harmful consequences. According to an article in the crimemuseum.org in 2018 stating that the research had consistently shown time spent in prison does not successfully rehabilitate the most inmates, and the majority of criminals return to a lifetime of crime almost immediately. This is why prison is a waste of time and resources, whereas rehabilitation programs cost far less money and have way better outcomes that benefit the patient and society. This argument upholds the value of quality of life because instead of throwing a patient into prison and furthering their disease, we're treating them in a humane manner that gives them another chance at being a productive member of society. Thank you.